Hi, my name is Mike Sadlowski. I'm a health promoter here at Norwest Co-op Community Health. We're here with the Hands Kai program. We're going to be discussing mobility and the difference between it and flexibility. The aim of this program here is to kind of get people used to breaking down some of the barriers that are preventing them from doing exercise by trying to increase their mobility with simple things that you can do at home. That should lead people into a more active and vibrant lifestyle. So in Hands Kai, we discussed the difference between flexibility and mobility. Flexibility is good to have, but basically the difference between it and mobility is that mobility is a controlled movement of the actual limb, whereas flexibility uses, either somebody else pulling on your arm or using a wall to get an extra stretch or range of motion. Mobility is hugely important when it comes to actual balance, and a lot of balance training doesn't incorporate proper mobility and stability. If we back up and think about when most people fall down, apart from walking on the ice in Winnipeg, you can think about in a bathtub. Imagine beside me is an actual bathtub side. And it's usually when people are walking in or just getting out. And it comes at the point when the body becomes unstable, such as this, and the body has no mobility either in one hip or doesn't have enough stability on one side. The stability is going to be coming from a lot of strength training and that, whereas mobility is going to often take a lot of work on the individual. When somebody's up on this point here, the body needs enough mobility in the one hip to be able to move the body as it's off balance from the center of gravity to be able to come over that ridge. It also needs enough stability on this side. So in my butt, on the side of my abs, it needs all that strength to be able to keep me upright. Proper balance training often will come from going to the grocery store and carrying grocery bags rather than holding one side heavy and trying to walk forward. I want people to kind of create movement by walking forward, holding their grocery bags, even if they're unstable, but keeping the stability and being able to move properly. A lot of it is going to come down to the actual hips. We're going to use a couple tools today to help break up some of the tension that a lot of people will have that holds them back from being able to do a lot of activities in that. The biggest factor is to kind of get the blood pumping. Once the blood's pumping, within about 5 minutes, those suffering from arthritis can often do a manageable amount of exercise. It's just trying to get over that hump. So that goal today then is going to be able to break down some of those muscles that are tight, that are basically acting almost like a kinked garden hose and not allowing the blood flow to travel through the muscles nicely. Once we can kind of break up those muscles, break up all that tension, then stretching, the flexibility, the mobility, and the actual strength, balance training will all kind of play a role in your new active lifestyle. Okay, so let's get started with some stuff that you can do at home. So keeping in mind that a lot of people have mobility issues, I'm going to do most of this work from an actual chair. This happy guy here is the body stick. You can pick these up sometimes at Walmart or an athletic store, but if you're at home or on a fixed income and you have a rolling pin, it's just as good. Basically, I'm going to use this to help massage different parts of my muscles and also help circulate some extra blood flow, particularly to the knee region is what I'm going to be looking at. The knees are notoriously bad for not receiving a lot of blood flow. That's the reason why they're often stiff and why even athletes take a long time to recover from knee injuries. One of the biggest things that we're going to look at today is the actual hip flexor muscle. Most people, if they live a sedentary lifestyle or if you're an office worker, are often sitting down for long periods of time, which shortens the muscle right here. This will actually pull the hips forward, cause a lot of low back pain. It'll also have an impact on all of your walking. Usually when we look at knee pain, I often will look at the joints above and below. So I'll look at the ankle for its mobility, flexibility, that sort of thing, and also the hip. So like I said, the majority of people are actually going to have shortened hip flexors. So to break that down using our stick or a rolling pin, what I would tell people is just to apply a fair amount of pressure. A lot of this work will take some elbow grease, and if your muscles are very, very tense, you will notice some pain. It's natural to feel it. Just imagine that muscle is already making a tight fist and it's already touching the nerves. So as we apply a little bit more pressure, our brains are really going to feel it. Now you're not going to be able to do any kind of damage to the muscle, nothing to worry about in there, unless you actually take your rolling pin and smack yourself with it. But we're not going to be doing that. So what I want to do is basically work in this region here. So the hip flexors, there's the hip flexors, iliopsoas. There's a lot of stretches that will come along with that as well, which you'll be able to see in the other DVD videos. But for now, I just want to help break up the muscle, break up the tension, and get the blood flow moving. Take your rolling pin, just at an angle, and press in right where your groin and your leg kind of meet. So right in your hip joint. Massage back and forth. You can angle in different parts, and you'll notice quite quickly exactly where some of those pinch points are kind of actually affecting you. Move just back and forth slightly. If you can find the spot that hurts the absolute most, it sounds sadistic, but hold that spot for about a good 60 seconds. Inside the muscles are the Golgi tendon organs, which basically act like little receptors. They'll send a signal to the brain, which will make the brain naturally release that extra bit of tension. So this isn't a quick fix. This will actually take some work and time, just like an active lifestyle does. But this will actually tie into a lot of your newfound mobility skills. So going back and forth in the hip flexor point is important. If you're noticing that it's not too tender, just go back and forth about 20 times and then move into the actual quad muscle. So imagine that you're kneading dough. We're actually helping to push some blood down towards the knee. And I'm using actually quite a bit of force as I'm doing this. Now, if you want to go up and down, that's totally fine. Take about 5 seconds to really push down, move forward, and then 5 seconds back. Again, aim for about 20 repetitions per muscle group. If you're noticing that you are getting a lot of knee pain, this next part here, I don't want you to go directly onto the knee. Obviously, it's just a couple ligaments on that and tendons that are attaching there, so it's not actual muscle. So going right over top of the actual knee or where the pain points are on the knee won't actually help you. We're trying to get the muscles that are pulling on that knee, like that marionette puppet, we're trying to get those muscles to actually relax. Turn your leg outwards so that you can actually get on the inside of your thigh now. So go right up to kind of this teardrop muscle right here. And travel up as high as you can into your groin. So once you've done that, turn the leg back out. And this, for a lot of people, will be a high point of pain. You might have to bite down with it, but just go as gently as you can. As time goes on, you will be able to slowly break down this muscle right here. And really put some muscle into it. Lastly, if you're able to, go behind the leg and try to get your hamstring. So using just your own body weight, try to keep a good posture. Don't be lurching over, but just back and forth. Again, we're just promoting extra blood flow. So all of these muscles here, the upper thigh, all are going to affect a lot of the blood flow that's coming through the entire leg. It's not uncommon to actually get flushed in the face as we start to break up a lot of the tension in the muscle. As that blood flow increases, you might feel your cheeks getting warm. It's totally natural. Also too, if you get a lot of swelling in your legs, this might actually stimulate a reduction in the swelling, just because we're actually increasing the blood flow and the body is now able to pick up some of that pooled water basically at the bottom of your ankles and toes and that. So after we've done the upper thigh, we have two muscle groups basically that we really want to look at on our lower leg. So the outside of our leg and then also our calf muscles. I'm going to start with the calf muscles. I tend to go directly behind the knee. There is a muscle there that will often pain a lot of people if they stand for a long time, or if they have a lot of retail jobs where they stand behind a cashier or something. That muscle is actually called your popliteus. Its job is basically to lock your knee. And if you stand in a locked knee position for a long time, that muscle actually swells and it can cause a lot of knee pain, referred to in different spots of your knee. So this just going up and down. Try not to go directly onto your Achilles tendon. We just want to get the meat of all of your muscles. So back and forth there, turn your leg out. Last but not least are your peroneals here. So these guys attach right from your ankle up to the side of your knee. And we're going to break down these guys here. So I'm going a little bit faster than I should. But again, when you're at home, you can do these throughout the day. You can't really overdo it. Tying this in with a good stretching routine will help kind of get your limbs a little bit more limber. So when you are a bit more mobile in that, you are basically good to go towards most exercises. So moving on from that, we're going to get into the spiky ball or tennis ball from at home. You can pick these up from most athletic stores. If you're in Winnipeg, Diamond Athletics sells these. If you're at home, it looks like a dryer ball, but it's a little bit different, a little bit more pliable to it. Some people will find this next part a little bit too painful if they use this spiky ball. The idea of this is going to be to break down some of our upper back musculature so that we can get and promote actual blood flow there. That is going to actually have a huge role in reducing some of the tension headaches that a lot of people feel. So if you often will get headaches that are almost above your eyes, that'll help out with these muscles here as we break those down. It'll also help out quite a bit with shoulder mobility. So the shoulders often, we'll see people will work directly on the shoulder, but the back actually plays a huge part of that. Just because your shoulder blades are in your back, so the muscles around it are too tight, your arms aren't actually able to lift up as high as they can because that tight muscle is pulling them straight back down. Okay, so I have my spiky ball. The one tricky part to this is actually getting it against the wall and getting your body weight back onto it. So it will take some flexibility in your shoulder to be able to do that. If you have somebody else at home that can help you out, all the better. Once you get used to it, there's just a little trick kind of to it. So take the spiky ball. I'm not too concerned about exactly where in your back you place the ball at first, because I'm going to be moving side to side, up and down. So I'm trying to basically hammer out as much as my upper back as I possibly can. So take the spiky ball, put it over top of your shoulder, and just by using your own body weight, you can kind of get that ball to roll back and forth, up and down. Right now I'm kind of targeting my trapezius. So I'm getting a lot of these muscles here that affect my neck, part of my shoulder, that actually comes right down to the middle of my back. So moving side to side, the more pressure I can put, the better. So if I wanted to, I can scoot my feet forward. If that's too much, just bring your feet back. So back and forth. If you want to get that ball lower, I always bring my butt back to the wall and just kind of lean forward and let the ball drop down. And then now I'm actually on my left side. If I need to get back higher, obviously it's up to me to kind of just move. So again, it's just small movements. So even if you are suffering from mobility issues, this shouldn't be a hindrance at all to you. So just small movements. The payoff to this is huge. So right now I'm back up to my neck. You can tell there's no real, it's going to be next to impossible to try to get 20 repetitions in a perfect line. Just back and forth, the more you can do it, the better. Try your best to avoid getting directly onto the spine. Obviously you'll notice that it's kind of uncomfortable to go on a bony surface. Again, we're just aiming for muscle groups. If you are suffering from a different shoulder pain and that, try moving back and forth around the back of the shoulder. Give yourself a couple good breathers, because the next part I want you to do is to take your arm and cross it across your chest. That will actually slide your shoulder blade out of the way, and it kind of exposes some musculature that often doesn't get a lot of work, but often gets a lot of tension, especially if you're a cleaner or you do a lot of vacuuming at home. You'll find the exact spot pretty quickly because your eyes will almost start to squint. So again, you get to control the pressure, but we are using all the little spikes on the ball to just kind of relieve and break down some of that tight musculature. That's really all there is to it. Once you're done, you're done. So now that we've finished that, we've broken down some of the tension in our legs, we've promoted extra blood flow, we've helped stimulate those legs to be able to do any kind of lower body exercise. You're primed for any kind of stretching that you may want to do, or just going for a walk. We've also worked on the upper back. So we've actually loosened up some of the musculature around our shoulders, back, neck, in that area. With that, you should now also be able to do upper body exercises and upper body stretches with a reduction in a lot of pain just because of muscle shortening in that. From here, you can keep going on. Follow the CDA brochure number 3 that we had given you, the resistance band exercises that you've seen in this DVD, or you can follow the stretching routine. Other options also too are now to go into the yoga one and see what exercises you can do from that video as well. Well, good luck to you, and hope you feel much, much better.